Hi, welcome to All Things Health. I'm your host Hefisia, and today we will be focusing on appendicitis. Today we are joined by a group of esteemed guests who will give us all the facts about appendicitis as well as a presentation. Stay tuned.
My name is Nicole Diedrich, and it's my pleasure being here.
I'm Leslie and Coombs. Thanks for having me.
Shanice Boris, happy to be here.
And I'm Christina Pink. Let's do this, guys.
Almighty, I want to man. Where the belly pain come from, man? Oh God, can't stop vomit. I don't know where the belly pain come from. Oh God Almighty, boy. You know from looking to it, man. A long time it a beer so you know man it a get worse, about 2 weeks it a beer so far you know. On and off and it a get worse for me. I have to go to the doctor tomorrow morning if this don't get better. I have to go to the doctor man. I call down there you know. Oh God and tell her about the pain and she said me for watch it. And me I watch the pain from when. And then I get better in the whole of the right side there so cramp up in the eye. I would have cause this now, man. Pain and walk me left to right, middle, center, back, front. No, sir. I can't manage this pain. I can't take it no longer, man. I can't take it no longer. Me have vomit. Fever that killed me last night, you know. Diarrhea. How really harm to me? So much weeks now. No, sir. No, this is the right at all, boy. God. I want this for me, God. Nurse, doctor, me need emergency, man. This will kill me. That pain, I can't manage that. I can't manage that all, boy.
Please.
Sit down. Lord God, nurse, you have to go carry me to the doctor. I don't feel good.
Good morning. I am Nurse Diedrich, and you are?
Christina Pink, nurse.
Okay, Christina. So, what seems to be the problem this morning?
Nurse, me I feel a heavy pain right here on my right side from when you know about 3 weeks now. And me I say me I go watch it cause it's on and off. But no, from last night, you know, it a act up really bad. Me a vomit, diarrhea, me a sweat. We can't manage it. Right now it feel like it has swell up on me, you know. It hot man, you have to go make me see doctor. So I did me I go did right here in the chair. The last time I this nurse at the last time I this. Me need to see the doctor. You have to go start right it down and carry me, nurse. We can't manage no more.
Christina, are you feeling any headaches?
No, right now me don't know what else me I feel. Me tell you say me I do though myself vomiting and them something there. That alone, nurse, and the pain.
So, where do you feel the pain the most?
Right over here, so on the right side, the right here, so me can't hardly touch it, nurse.
Yes, Christina. Is the area red or swollen?
It feel like it swell to me.
Okay, Christina. So, the area is swollen. Yes. Anything else, Christina?
No, nurse, me need to see the doctor. That next.
Christina, since there are no more symptoms or signs, I'm going to take you to see the doctor now.
Okay, miss, right now, right, miss.
This way.
Good morning, Miss Pink. I'm Dr. Clark, and I'll be your doctor for today. How may I assist?
Well, doctor, all of them so kill me. Me can't manage this, doctor. Right, yes, sir.
All right, can you rate the pain on a scale of 1 to 10 for me?
1 to 10, doctor. 100 over 10 is
100. All right.
Yes,
And where
doctor.
exactly are you feeling the pain?
right. Another can show you, doc.
Okay.
Right, yes, sir. No touchy, no touchy. Right over here, sir, doctor.
On the right side.
Yes, doctor.
Are you feeling anything else? Any nausea, any vomiting, any
Last night, I
sweating?
did have vomit and a sweat and I did have diarrhea. I say, alright, I go watch it till the morning. But the morning, I couldn't move to a pain. Hook me up, doctor. That's why I come down here.
And are you feeling the pain anywhere else in the abdomen?
Oh, over here, swallow.
Only over there? Alright. So I'm just going to palpate your abdomen and you tell me how great the pain is. Is that okay?
Yeah, man, alright.
And since you're feeling the pain on the right side, I'll just start on the left side for you. Just so that you can just tell me where you're feeling the pain the greatest. Okay?
Alright, doctor.
How does it feel over here?
It's alright so far over there. Yeah, come down to which party had. Oi, doc!
Oh, so the pain is greatest in the lower right quadrant? Alright.
Oh, Jesus Christ, you mash up my organs.
Alright.
Jesus, my good tool.
And you're saying that's the pain you're really feeling?
Yes.
Alright. Alright. So you're saying you're feeling it most. I'm just going to press on it and you're telling me if you're feeling it most when it's, pressed on or when it's released. Okay?
Alright, take your time now, no, doctor.
Alright. So we're just going to press.
Aye! Not do it again, man. When you take up your hand, when you take up your hand, it's hot, man.
Okay, so when you release, can you describe what you're feeling?
It feel like my liver rub on my lungs look a while.
Okay.
Jesus Christ, doctor, I saw you wicked and bad, man. Tell us that this is hot.
Alright. Alright, so let me just carry down your clothes. Alright. So what I can do is I can give you some pain meds for the time being, just to reduce the pain you're feeling.
Alright,
right? So I'm going to get it for you. I'm going to let the nurse administrate it to you, and then let you sleep it off a little bit, and I'll be back.
Okay, hurry up.
Miss Pink, I'm here to administer your pain medication now. Could you sit up for me, please? Here's the medication.
Miss Pink, how are you feeling now?
Doc, I feel better than before, and the pain really the up at 10 again. I would have rated maybe like a 3. 3 out of 10 now. The little pill them and something want to give me help me with a lot and stuff.
Are you still vomiting any diarrhea?
I'm not vomit right now, no diarrhea. I don't really get up and stuff. After the medication, I sleep and I feel better and something.
Okay. So based on the assessment that I did before, I believe that you may have appendicitis.
Lord God, what that now, man?
Appendicitis is just the inflammation of the appendix.
Okay.
Yes.
Oh God, I don't know nothing serious though.
It can be serious, but right now in this stage we don't know. We'll have to perform a series of tests just to confirm the stage of it.
God, what kind of tests? Like surgery and them thing there?
Well, surgery is normally the last option, Miss Pink. So right now we're just going to perform some CT scans, ultrasounds, stuff like that, just to see exactly how inflamed the organ is.
Oh Jesus! So, that my neighbor did that tell me something. Say like some feces or something can block up this something. Say that did that tell me, doctor? So I probably did that. No, at all, boy. Can do it? So
what I'm going to do now, I'm going to let the nurse schedule an emergency MRI. Right? So I'm going to send you in an hour's time, just to see, get an inside view of the inflammation that's going on there. Because you want to really and truly prevent rupturing of it. And based on your abdomen, if you don't mind me taking a look again, it's a bit discolored, and that is serious, right? So we need to get you in now, and we need to get moving. In the meanwhile, after you're out of the MRI, we'll give you some antibiotics based on what the MRI says. and just some pain meds to reduce the pain.
Alright, yeah man doctor. So basically that I eat then, so I could do after do then man.
Yes, so the nurse will be back for you in an hour.
Yeah man. And you say one time if everything alright, you go give me some more the pill them again.
Yes.
They work good for me.
Yes. So if it's based on the level of it, we may not have to take it out.
Okay.
So we don't want to schedule an emergency surgery. We don't know what's going on. So we just want to get an inside view, as I said before, just so that we can know what's going on and how to treat it.
Okay.
Yes.
So if everything alright, may I go sleep down here? You know I go watch me or something, or may I go get released and go home?
It's dependent on the progression of the appendix.
Okay.
So based on the information, you may be admitted for emergency laparoscopy, or you may be sent home with some antibiotics and be scheduled for another appointment.
Alright.
Yes.
Alright then doctor, that not sound bad then. Come when we go around at the place you say I go stay
Alright, so
there
the
now.
nurse will be coming for you in an hour's time.
Okay.
Alright. Miss Pink? No. Based on the results of your MRI, it is confirmed that you do have appendicitis. Based on the progression of appendicitis, we need to act now. So we are going to do an appendectomy right now. The nurse is coming to prep you for surgery, and the porter is coming to escort you to surgery.
Alright.
What is appendicitis? So appendicitis is an inflammation of the appendix, and the appendix is a finger-shaped pouch that projects from your colon on the lower right side of your abdomen. What causes appendicitis? So appendicitis is caused from a blockage in the lining of the appendix that results in an infection. The bacteria Escherichia coli, abbreviated E. coli, multiplies rapidly and causes the appendix to become inflamed, swollen, and filled with pus. Therefore, if this inflammation is not treated promptly, the appendix can rupture. This rupture is life-threatening and requires immediate surgery to remove your appendix and clean your abdominal cavity. A rupture spreads infection throughout the abdomen, and this is known as peritonitis. Risk factors of appendicitis. So if one has an infection, possibly stomach infection, the bacteria can travel to the site of the appendix, and this will result in appendicitis. Another risk factor is obstruction, and this may be caused from a hard piece of stool that gets trapped in the appendix, which results in an infection of the appendix. Finally, a previous abdominal surgery could be a risk factor of appendicitis. Clinical manifestations of appendicitis. So these signs and symptoms include abdominal pain, nausea or vomiting, moderate elevation in temperature, constipation or diarrhea, and loss of appetite.
Assessing a patient for appendicitis. This involves a physical assessment of the abdomen. So we are assessing for pain. So a gentle pressure is applied to the pain area, and then this is suddenly released. In appendicitis, if this worsens, it signifies that there's an inflammation of the adjacent peritoneum. Then a rectal examination will be done that involves inserting the finger into the rectum and feeling for the pain areas. So a blood test is done This is done because we want to count the amount of white blood cells that are in the body. So usually we are looking for high levels of white blood cell, which will signify that there is an inflammation. To confirm that appendicitis is present, we'll move on to image testing, which are MRI, CT scans, and ultrasound in children.
Treatment of appendicitis. Appendicitis is usually always treated as an emergency. Surgery to remove the appendix is called appendectomy. This is a standard procedure usually used for all appendix cases. Generally, if your doctor suspects that you have appendicitis, they will quickly remove it to avoid a rupture. If you have an abscess, you may get two procedures. One to drain the abscess of pus and fluid, and a later one to take out the appendix. What to expect during an appendectomy? Before your appendix is taken out, you will take antibiotics, which aids in fighting against the infection. You will usually get general anesthesia, meaning you will have to sleep for this procedure. The doctor removes your appendix through a 4-inch long cutout with a device called a laparoscope. This is a tiny telescope-like tool that lets them see inside your body. This procedure is called laparoscopy. If left untreated, an inflamed appendix will burst, spilling bacteria and debris into the abdominal cavity, the central part of your body that serous inflamed of the abdominal cavity's lining. Medications used in the treatment of appendicitis. Pain relief medications. Pain medications such as opioids, non-steroidal anti-inflammatory drugs, NSAIDs, or acetaminophen upon administration to the emergency room. Antibiotics. Most patients receive intravenous antibiotics as soon as they get an appendicitis diagnosis. To prevent infection of surgical wounds, intravenous antibodies are usually continued for 24 hours after surgery to prevent complications. Medications such as cephalosporins, carbapenemas, aminoglycosides, and lincomycins are also used in the treatment of appendicitis. There are 4 non-pharmacological ways in which you can treat appendicitis. Drink water, get adequate rest, avoid strenuous activities such as lifting heavy things, and go for gentle walks daily.
In an effort to prevent appendicitis, here are some fun things that you can do. You can eat a diet high in fiber, a balanced diet, exercise, take your vitamin supplements, and change your posture. Thank you once again for watching All Things Health. I'm your host, Kaphisia. See you next time.